Today I'm going to be administering a oral medication. This morning it's going to be for Mr. Jackson's PRN milk of magnesia related to his constipation for a bowel movement that was 3 days ago. So I'm going to first do some quick hand hygiene, and then I'm going to make sure I have all of my needed materials. So I have a printed out MAR with the patient's information on it. I have a pen to mark down on my paper MAR. I'm reading off the computer here for the resident's information. I also have a water cup here, a medication cup with the measurement labeled on it. And then I also have the medication with the medication label and information on it as well. Okay, so I'm going to start off by reviewing the MAR from top to bottom. I'm going to make sure that the patient's name is on here. It's going to be Joseph Jackson at the top. His date of birth is also on here. Mr. Jackson's birthday is May 1st of 1935. And I'm going to be giving him a 30 milliliter dose of milk of magnesia PRN, which is also listed on the MAR, and at 8 a.m. So I wrote in at 8 a.m. per mouth he's going to be getting this. Okay, and I am able to give this PRN to him based off of the primary nurse asking me to on this day shift. I'm going to check Mr. Jackson's MAR for allergies. There's penicillin and morphine listed on the MAR. And then I'm going to go ahead and perform some hand hygiene. I'm going to wash my hands or use hand sanitizer before I continue. Okay, then I'm going to go ahead and unlock my medication cart. And I'm going to compare the name of what's on the MAR to what's in the cart. And it says Mr. Joseph Jackson, date of birth May 1st of 1935. Okay. All right, and now for my second check, I'm going to go ahead and compare the label of the medication from the medication cart with the information on his MAR. So it's going to have a name. It says Joseph Jackson. The MAR says Joseph Jackson, and addresses are the same. I'm going to make sure the order says the same thing. Milk of magnesia, yep, 30 milliliters. Both stated on the medication and the MAR. Okay, and the expiration date is on here as well. Its expiration, it expires July of 2029, so we're still good. This is not an expired medication. Okay. Yep, and it just says PRN, and so does the MAR. All right. And for this medication, because it's PRN, it says on the medication label as well, and also from my primary nurse, it just says take by mouth PRN. So this is just going to be once for the constipation. So one time this morning. Okay. Then I'm going to go ahead and perform my hand hygiene again. Make sure everything's good. And then I'm going to go over to Mr. Jackson. And here's Mr. Jackson. Good morning, Mr. Jackson. My name is Katrina. I will be your TMA this morning. I'm going to have some milk of magnesia for you for your constipation. Can you tell me when your last bowel movement was? Okay, he's confirming it was 3 days ago. So I'm going to check his wristband, make sure it says Mr. Joseph Jackson. His birthday is May 1st of 1935. And another thing I can check on here is his ID number, which is also going to be in the MAR. Yep, medical records match up. Okay. So now that I've identified the patient with his name, his birthday, he told me his birthday was May 1st, and it lined up with the information on the MAR and the medication. Okay. I'm going to make sure that Mr. Jackson can swallow the medication and make sure he's eaten anything today. I did just ask him if he had a BM, and he said it was 3 days ago. So I'm going to say, Mr. Jackson, are you able to swallow this morning? And he's going to tell me, yes, I can swallow. Mr. Jackson, have you eaten anything or drank anything today? And Mr. Jackson tells me he's had a cup of oatmeal for breakfast and a glass of coffee. So that also, to me, I know that he's had breakfast, liquids and solids, and can swallow. And then I'm going to go ahead and take a set of vital signs on Mr. Jackson. So Mr. Jackson, I'm going to be taking a set of vitals real quick. Here's your blood pressure. The blood pressure is good. It's 117/76. I'm going to take his O2. Okay, his O2 is good at 97. His heart rate's good at 73. He's got a normal temperature of 97.8. And his respiratory rate is good at 18. Okay. So next, again, I'm going to double check the medication label for the MAR. So it has the name, the patient's name, as well as the medication name. This is Milk of Magnesia and Joseph Jackson. Okay, and then I'm going to make sure it's the right dosage, 30 milliliters, and that it says per mouth, by mouth. And it says by mouth. Okay. The route is the by mouth. The time, it is 8 a.m. and the date is May 12th. So I'm going to make sure that as I'm filling out the MAR, it has today's date on it, and it does say May 12th. Okay. I'm going to write down that it is May 12th at 8 a.m. Mr. Jackson's receiving 30 milliliters by mouth because of his constipation and his bowel movement that hasn't occurred in 3 days. Okay. And the expiration date is on here again, July of 2029. So I'm going to go ahead and do some hand hygiene again, just making sure we're all clean and everything. And we're going to go ahead, since we've checked our medication, the name, the patient, the date, expiration date, and what we're going to do with this. Now, on this dose of Milk of Magnesia, it is prepackaged, so it says 30 milliliters on the package, but just to make sure I'm giving an accurate dosage of the medication, for the purpose of this scale test out, I'm going to make sure to measure out the proper medication amount. So on a level surface, I'm going to have my medication cup, as well as this. We'll say this is a level surface. And we're going to make sure it comes out to the 30 milliliter line. Okay, so now I'm going to give Mr. Jackson his medication. There's water in here, our measured out medication. Okay, Mr. Jackson, here is your Milk of Magnesia. No, you're good on allergies. Okay, Mr. Jackson, there's that. And then I'm going to give him some water. There you go, Mr. Jackson. Okay. I've made sure that he took all of the medication dosage. He swallowed all of it just fine, and I offered water with it. He drank some water afterwards. Mr. Jackson was able to drink it all. So then I'm just going to make sure that I have it all documented in my MAR. I have 8 a.m. under his Milk of Magnesia per mouth with my initials. And there wasn't any medication calculating with this because it was just 30 milliliters and it was already measured to 30 and we measured it in our cup. I'll make sure that it has the date and time, 5/12, 8 a.m., 30 milliliters per mouth because of the constipation for the last 3 days. Then I'm just going to make sure I initial it. And it should be the same on the MAR, the whole MAR, because I did sign my name and initial next to the name. That way people know, in fact, it was me and those are my initials. All right, and I don't have to document any refusals because he took the medication perfectly. And from there, I can make sure it's all documented. That way that my primary nurse this morning knows that there were no problems giving the medication was given and it all went well, and the information for the medication matched up with the patient's identification wristband as well as in the MAR. All right, bye, Mr. Jackson.